familiar sequence of events unfolds in the national capital region before the winter every year, as you've seen. The monsoon retreats, dries the air and the wind drops. The pollution from construction, industry, road transport being masked through the year actually becomes more visible. The recurrent tragedy of addressing the problem of air pollution in Delhi is that it invariably descends into a blame game. But joining us on the broadcast, Dr. Suneela Garg, member of the Lancet Commission COVID India Task Force and an advisor for the ICMR and World Health Organization, to weigh in on the measures that may have helped so far and the long road ahead. Thank you so much, Dr. Garg, as always, for joining us. Now, we know that Delhi still needs to reduce levels by about 55 to 59% to meet national standards as far as the levels for PM 2.5 are concerned. What should Delhi focus on now? What's your advice as a medical professional?
Thank you so much, Parmeshwar, for having me on the show. As usual, I think every time around, September, October, November, Delhi fights hard for, fighting the pollution. And then similarly, our wards are full because of the elderly being infected or, are affected and infected both, and even children being infected or affected. What we have to see is that, and also we have to see that, apart from, reducing the morbidity, we have to take concrete actions. Some of the important concrete actions is, as you remember, first time, I think few years back, Delhi had started odd even scheme also. But then that was meant for some people and it did not, make a major difference. And during that time, we had carried out one study, in Delhi, we're aiming at 7,000 individuals, and which showed that 30% people's lung functions were impaired, and that was one study of its kind. So, what we have to see that we have to take consistent measures in the long run, and important being, we have to take action against vehicular pollution, stubble burning and all, but open garbage burning also is one of the important things. And in long run, we have to take sustainable measures, with regard to when we talk of, construction sites. And another important part is that we have to see both indoor and outdoor pollutions. That is also very important because outdoor pollution also has got very important effect on indoor pollution as well. And, we need to focus, much more in depth, about our vehicles, their status of vehicles, their maintenance and all that, the use of gasoline. So all these things, they become very, very important. And then at this point of time, not only we are worried about, the elderly, children and all that, but again, we need to somewhere think about when people are wearing masks and all, whether we should bring it again so as to, have a better effect, and we have to protect the population.
Absolutely.
But again, immediately action has to be taken with regard to neighboring states, with regard to stubble burning and providing them with machines that will make a major difference. But this cannot go on and on. That is important.
Right.
We cannot have more preterm mortality and all that. So we have to work hard towards the direction, and with a vision document, we should be going ahead that by these many years, these are the actionable points, and subsequently we have to, focus on absolute control of air pollution. At least we should aim at less than 50, which is a better this thing, so that Delhi people can breathe, comfortably.
But there's no denying that a need for strategy to address volume of traffic and a massive mobility transition, also a clean mass transport mode is needed. But Dr. Garg, are you witnessing a surge in patients with respiratory issues so far this year?
You see, definitely, as I'm based also in NCR, so I can see, people with childhood asthmas and all also are increasing. But, now it's the beginning, it's the warning. Gradually as we go ahead and the, temperature will come down further, this will have further effect. So right now is the time, through your channel, I like to say that people should, should go out only when it is necessary, particularly when we are talking of elderlies and children, when we are, in that context we are talking. But it is very important to keep a watch also around this time about hospitalization, number of cases and all that, and who are the ones who are infected and affected both.
Right. As you mentioned, public transport has moved to CNG. These are some of the measures that have been taken in the past. There are restrictions on old vehicles. Electrification of fleets is being encouraged. There are now emission standards for vehicles as well. In fact, in some areas, there's strict restrictions as far as coal power plants are concerned. But Dr. Garg, what do you think has really worked so far as curbing pollution is concerned?
See, I'll say that one thing which has worked is in outdoor pollution, as I was telling you, is taking care of the vehicles, because they account for 25% of our this thing. Still, we have a long way to go. And another, milestone in this direction is electrification of the vehicles. And also, we are having rapid mode of transport also that will work in that direction. But then, and also we can see lesser of garbage burning as, our societies have become much more concerned in that direction. People are aware of, and they are watchful also, because there are, people are now not allowing them to do that. But then I will still say we have a long, distance to go, particularly with regard to, when we are talking of stubble burning and all. We are trying, where a lot of awareness has been created, but awareness has to be translated into action.
Indeed.
And also we have made a difference with regard to construction sites also. People are covering construction sites and all. But I said that Delhi is not only Delhi. Delhi is complete NCR when we are talking of big area of Uttar Pradesh, we are talking of Haryana, we are talking of and all that. So, so Delhi's own identity becomes, kind of submerged by the neighboring states and the, effect of environment in these areas. So we have to be very watchful with regard to that.
Well, Dr. Garg, as always, thank you so much for joining us on NDTV.